Welcome, I'm Enrico Maraskin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Meningococcal infection, this is also a bacteria as the previous two, and this disease can cause meningitis and septicemia. It's also a devastating disease and can take human lives at a very rapid rate in a matter of hours.
This disease is most common in young adults, especially at university-going age, where they are in close contact with a large number of people, which results in a huge exchange of infectious organisms between students. Infections can also occur in children between the ages of 6 months and 3 years of age. Mortality is high and is as high as 40%. So if you get this illness, it's like flipping a coin as to whether you're going to survive or pass away.
So this disease can literally take you in a matter of hours. The brother of one of my fellow students at medical school joined university in his first year of university, and he was very well in the morning, walked to university, got ill rapidly during the course of that day, collapsed, was rushed to hospital, and despite introduction of the treatment, he died on the same day, in fact. In the pictures, we see on the top picture a child also infected with the same complications that we saw in the earlier disease process, the pneumococcal illness. And on the bottom slide, we have the classic rash that warns doctors that you may be suffering from this condition. Many years ago, I had a child who was transferred from out of South Africa, in Africa itself. He was infected with meningococcal meningitis, and he was about to be transferred to my clinic. Thankfully for this child, the attending doctor at the airport did administer antibiotics prior to the transfer to South Africa, because had this doctor not been so astute and done his job so well, that child would probably not be alive today. To my knowledge, this child is still living today, probably about 20 years later.
So, having considered the facts, pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate.
So thank you for joining me, Enrico Maraskin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against. And I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.